if a patient is really struggling with the HPV associated diagnosis or depression related to their cancer diagnosis, what are some initial steps to help him or her?
Thanks, Amanda. That's a great question. I think Jason really nailed that point there. When you start to look for the information and gather your resources and figure out, okay, how common is this? What's the pattern here? Is there anything to learn about this and be concerned about? And that really can go a long way in sort of helping calm down some of those feelings of anxiety and perhaps some of those feelings of depression. Knowledge really is power here in situations like this. The range of emotional responses to learning about an HPV-associated cancer can, as you mentioned, be really quite mixed. Lots of patients experience some surprise or some embarrassment. Even some patients feel optimistic because they realize that there are differences in treatment, differences in outcomes for associated cancers. And so gives them a little bit of a different perspective on what can be a very challenging diagnosis. But we also want everyone to remember that, a feeling of sadness or anger or depression, all of those responses are valid. Everyone has a different way of responding. There's no wrong way of responding. It's very normal to have even a combination of all of those different emotions kind of rolling around all at once. What we want folks to remember is that, while those experiences are normal, they can make it more challenging to make sure we're adhering to treatment, getting our most effective care, thinking clearly when we need to ask questions to our physicians. So we try to remind folks that if those symptoms kind of stick around for a couple of weeks or more and they start to interfere with your ability to concentrate, get things done, carry on your daily activities as much as you would like, that's when it's time to start asking your physicians or leaning on your support networks to find additional resources that can be helpful to support someone when they're being challenged by those additional emotional experiences.